Hello everyone, it's Mackenzie here, and today I'm going to talk about cystic fibrosis. Pretty much what cystic fibrosis is, it's an inherited disorder that's inherited both from the mother and the father. It has to be from both, not just one, and it damages the lungs, the digestive system, as well as potentially any other organs in your body. So, a normal lung, you have these goblet cells that will produce mucus that will create a thin lining that's going to help prevent infection by collecting any debris, viruses, bacteria, or anything you can imagine that comes into your lungs. These multiciliated cells that you see here are going to act as a broom and kind of sweep everything up and out of the lungs. In a patient that has cystic fibrosis, on the other hand, you're still going to have these goblet cells that produce mucus, but your cells are going to have a difficulty pumping chloride in and out of the cells. This is going to result in everything being dehydrated, and the mucus is going to become super thick and sticky, and it's not really going to move around how it should. And as a result, all of that bacteria or debris or everything that gets kind of breathed in through the lungs are going to kind of stay in the same spot and cause different types of infections and different things going on. And then your body is actually going to send white blood cells to that area, but because everything isn't getting moved around and stuff, they have the potential of bursting, which is actually going to release all this DNA that you see here in this picture. So, some signs and symptoms that you may see in patients that have cystic fibrosis. Some respiratory signs are the thick and sticky mucus that I was talking about, persistent cough, wheezing, exercise intolerance, repeated lung infections, as I mentioned, inflamed nasal passages or stuffy nose, as well as recurrent sinusitis. Some digestive things you may see are like foul smelling, greasy stools, poor weight gain and growth, interstitial blockage. This is particularly seen in newborns, as well as the potential of chronic or severe constipation. Some other signs and symptoms that I don't have on here are actually salty sweat, as well as some reproductive issues that you see in, well, older patients. Sometimes infertility can be caused in both males and females. And some treatments. There is no cure for cystic fibrosis, unfortunately. So there's a couple of treatments that's more for comfort care. There's the albuterol treatment, which we all know that it's a bronchodilator and uses our beta 2 and kind of just opens up the airways and does its thing. You can also do a nebulized hypertonic saline. This is going to kind of humidify the lungs and that really thick mucus and kind of aid in the making it become less thick and moving it around and everything. The Dronase alpha is going to do a similar action as the nebulized saline. And then the last treatment, which we won't really do, is the chest physiotherapy. Sometimes cystic fibrosis patients will have these specialized vests that vibrate and kind of acts as a subwoofer and kind of vibrates everything and shakes everything up in your lungs to kind of help you aid in, I guess, kind of coughing up all of that gunk that's in your lungs. This also can be done using percussion, using your hands and stuff. So yeah. I also have linked a case study that actually kind of goes more in depth with cystic fibrosis and kind of the causes, how it's done, and everything, and as well as I have the Mayo Clinic website linked here as well, which is where I got a lot of my information from. Thanks for listening.